Okay, so hi, my name is Alejandra Ponce, and in this video I'm gonna explain the chest draining units, which is this one. We have two different ones. We have the Ocean, which is a wet unit, and then we have the Oasis, which is the dry one. This one will be blue and the package, and the other one will be green on the package. And so what happens with the Ocean, with the wet one, is we're gonna have chamber A, which is suction control chamber, and the expected finding in this chamber is to see continuous gentle bubbling. And then we have the B chamber, which is the water seal chamber, and the expected finding in this one is tidling, which is watching the little ball go up and down with a patient's breathing pattern. And then we have chamber C, which is the air leak monitor. This one is the one where the nurse needs to be aware of at all times and be monitoring it, because this one is the indicator that if there's too much bubbling in there at a certain point in the day, that would mean that there's an air leak, and the nurse will have to troubleshoot to find where the air leak is at. And this over here is the drainage unit. This would be connected to the patient, and this is where all the drainage will be coming out, and then it'll be measured, and you will be measuring that on your I's and O's. And also, if the doctor will tell you how much is too much and when to call him. These are the tubes. One will be connected to suction, and one will be connected to the chest tube of the patient, and there's different sizes, and the doctor will tell you which size he needs according to what the patient situation. There is 24, 32, and 36 French. Usually the 36 will be used for trauma patients, and like I said, the doctor will be the one to decide which one. One thing that the nurse needs to do is that as soon as the doctor puts the chest tube in, the nurse has to make sure that there's always an x-ray order, because that would check placement of the tube to make sure that the tube is in the correct place. So that's the function of the Ocean one. And so I forgot to say how you will set it up. When you put the water in, you would put with that funnel, you're gonna attach the funnel, and then with the stopcock, this is called the stopcock. When it's up and down, it means it's open. Like, this shouldn't be here, so we're pretending we just have this one. So when it's like that, up and down, it means it's open, and then when it's side to side, it means it's closed. So we're first gonna have it closed, and then we're gonna fill the water here. We're gonna need about 20 centimeters, and once we have the water in here, we're gonna open it back, and we're gonna allow the water to pour down to the mark, and then we're gonna remove it, and then we're gonna this one will be closed, and while it's closed, we're gonna connect the suction, and then we open it and we adjust it here to the pressure that the doctor wants it. So that's the function of this stopcock, and then, like I said, the other one goes to the patient. So that's the Ocean one, which is based on water. Those are its functions. Now I'm gonna move to explain the other one, which is the Oasis one, and this one will be different. So this one's not gonna have the stopcock. This one's just gonna have the tube, and then this one will come with a pre-filled syringe with the exact amount of water that we need for the water sealed chamber. And so we're just gonna invert it on top and then push all its contents in, which will fill up to the 2 centimeter mark. And then this one will disconnect the pre-filled syringe, and then we'll connect the suction to it. We connect the suction, and then this one will be controlled by the dial that is right here. This particular one, Oasis, is like I said, dry, and this one is connected, so the suction will be on the wall, and then you can turn it up all the way. It doesn't really matter because the dial is what controls it. It's usually -20 and it can go up to -40, so this one is mostly used for traumas because it can go very negative pressure, high negative pressures. And then that's the dial to control the negative pressure. And then we have chamber E. That one has an accordion, and if the accordion is expanding, it means that the unit is working okay. It also has the drainage unit, which will measure the amount of drainage that it has, and this one is the one that is connected to the patient. This one also has the titling to measure the patient's breathing pattern, and then again the water seal, and also it's the same concept as for the wet one. We always have to be aware of what's going on in this chamber because excess bubbling means there's an air leak and you have to find it. So those are the differences in the units. Now I'm gonna talk a little about the patient and the chest tube on the patient. So it's important for the nurse to always note where the location of the chest tube is, because that's what's going to tell what's wrong, where the problem is. So the nurse needs to know that if it's in the lateral aspect, mid clavicular, at the 5th intercostal space, it's in hemothorax. And that if it's mid clavicular, 3rd intercostal space, anterior part of the chest, then that is indicator of a pneumothorax. So the nurse always needs to know if it's a hemothorax or a pneumothorax, because that's very valuable information when telling the doctor about the situation and in case there's complications. It's always important to always do your assessment on the patient, check for your vital signs and for lung sounds to see, and also see the patient, assess the patient, see that he has no trouble breathing or complications. And so that's the patient. And then things that you should always have at the bedside is normal saline, a basin, which I don't have at the moment, but you would have a basin. And then you will have tape, plenty of tape, and 4x4 gauzes, and also some hemostats. And what these are useful for is, what these things will come useful for would be when certain complications happen with the unit or with the chest tube. So some of the complications that can happen is, for instance, the chest tube can become disconnected from the patient. And in that instance, what you would need to do is you would grab a 4x4 and then you would put it on the side. If the chest tube, in case it came down, you would grab the 4x4, put it and tape it only on 3 sides. And only 3 sides. And that's what you would do with the 4x4. Another complication that could happen is that say the patient went to a procedure and then the tube became like disconnected from the unit. In that case, what you would do is you grab your basin, fill it up with normal saline, and create a temporary water seal. That's what the normal saline comes in handy for. So that's what can happen. And then another complication that can happen is that you can, if you're looking at your unit and you start seeing bubbling in the C chamber, that would mean that there's an air leak. And what you need to do in case of an air leak is you would come and you would troubleshoot to find where the problem is. So you would grab your hemostats and you would start looking for the air leak. you would face your unit towards you, and then you would start clamping in opposite directions. So you would start in the proximal side to the patient, and so you would put your first clamp, and then you would look at your C chamber and look for stopping of the bubbling. If the bubbling is still going on, it means the leak is not in that part. So you would come down and put the second hemostat on the about an inch away on the opposite direction. Again, look at the C chamber, and if the bubbling stopped, doesn't stop, then you keep going. You would remove this one, and then you go out again about an inch, and then look at your chamber. If at that point the leak stopped, and you remove this one in the opposite direction. At this point, if the bubbling did stop, then that means that this is where the air leak is at. So it means at this point that the air leak is in the chest tube that's connected in the chest tube on the patient. So what you do is you unclamp it. You never want to leave the clamp on, because if you do, that would lead to another complication, which is called tension pneumothorax, which I'll explain a little bit later. So in case once you find your air leak, what you need to do is you need to grab the phone and call the doctor, or if you need to leave, then you always need to make sure you call a nurse and have the nurse stay with the patient, never leave the patient alone. And so you would call your doctor, and you would use IS-bar and to communicate that there's an air leak. You would give your background, and you would give your assessment and your recommendation, and the doctor will tell you what he wants to do. And so that's what you do in case of an air leak. Most of the times the doctor will want to, if the air leak is on the unit, the doctor most likely is going to tell you to just change the unit for a complete new one along with the tubing, and that should fix the problem, but you always need to call the doctor regardless. So that's how you do troubleshooting to find the air leak. So going back to the other complication, which was the tension pneumothorax, that can happen because of you leaving the clamp on for too long. You would create a tension pneumothorax, or also it can be caused by clots. So if there's a clot in there somewhere and it's staying there for too long, that will lead to tension pneumothorax. And when that happens, that's an emergency, and what you need to do is call the doctor right away. And if he can get there soon enough, then he will to fix it. But if he can't, you need to call a rapid response at the hospital so that the emergency doctor can come in and fix it. And the way to fix a tension pneumothorax is by doing a needle decompression, but only the doctor can do that. So if that needs to be done, the nurse's job would be to have a thoracotomy tray and a big needle ready for the doctor to perform the procedure. So the nurse needs to be ready with those things. And so another thing with tension pneumothorax is that the nurse should be aware is that if you see a deviated what's it called, trachea, if you see a deviated trachea, that means that's a late sign of a tension pneumothorax. It means it has gotten too late for too long, and you would see that. That's one thing that nurses always document. Important to document. Always document how you see your trachea, if it's deviated or if it's normal, because that's what it indicates. And that's it for now.